So, I am certainly no stranger to the thinning of one's hair and male pattern baldness. I have to thank my parents for this on both sides. Well, the genetics are very much in my favor that this will continue to wither away. And to be quite honest, I am always terrified when I go to the barber that will cut it away and one day it will just never grow back. Now, many have told me that it's time to embrace the baldness, to just shave it all off. And to them, I say, well, I live in Canada and it's bloody cold, so I'd like to keep some kind of hair on my head. Number two here, well, this haircut seems to offend a lot of people, so why would I want to not offend people? That's part of my pleasure of doing these videos. And number three, I just haven't quite developed that confidence yet. Now, my male pattern baldness is primarily due to genetics, but what about potential hair loss that comes with the GLP-1 receptor agonists such as Ozempic and Saxenda? Of course, before we dive into that, everybody, welcome back to the program. My name is Dr. Dan. I'm a pharmacist turned obesity expert, and of course, I want you to hit that subscribe button down below so that you don't miss my hilarious videos talking about my male pattern baldness. But so you can also continue to check me out and be up to date on all the ins and the outs of what I am currently doing. Of course, check me out on my other channel at The Official Dr. Dan. I'm on the Tik, the Talk, the Gram, the Book, you name it, I am out there. And of course, if you are wanting some help in your weight management journey, check out my website, healthcareevolve.ca, and you can book a free consult with myself, and we can see if you are a good fit for my team and seeing if we can help you out in that regard. So, hair loss with Ozempic and Saxenda. This has been a question that has been circulating on the interwebs on various forums. I've also had a number of followers, subscribers, and that sort of thing asking questions in this regard as to why an individual might be losing their hair. Now, I have not personally worked with any clients or patients who've been taking these medications and have experienced this side effect, but I'm going to kind of provide you the best information that I could from the research and what is potentially out there, as well as some of my potential hypotheses as to what might be going on. So first starting with, well, what do we even know as of right now? And I wish the answer was really more straightforward, but when we go back to the main clinical trials that basically got these GLP-1 receptor agonist medications to market, there was no mention of people experiencing alopecia or hair loss when taking Ozempic, Saxenda, and the other GLP-1 receptor agonists. And these trials included thousands of individuals, but during the course of these trials, hair loss was never reported as a potential side effect. It wasn't until these drugs got onto the market and the general population started taking it, so not only did we have way more people that are now taking the medication, but it got out into just regular everyday life type of people, and people started to report this as a side effect. And we've seen this happening in particular since Ozempic has come to the market. So does this mean that hair loss is a rare side effect with the GLP-1 receptor agonist, and we didn't see it until it got to a large enough group of people out in the public that all of a sudden this side effect came about, and within the clinical trial in the thousands of people, we just didn't see it? Is that the situation that's maybe going on here? Again, it's a bit tough to say. What we know from the mechanism of how the GLP-1 hormone acts within our bodies, there isn't any mechanism that we're aware of or that we've identified that it might act at the hair follicles within the body and ultimately lead to hair falling out or thinning out. So while there's no plausible mechanism at this point in time, does it mean that there is something we just don't know? I mean, absolutely. That's kind of the beauty of science. There's lots of crap that we don't know and we discover later on. But as of right now, we don't have a particular mechanism or way of saying like, yeah, it causes hair loss because of X. We just have no idea. It doesn't make any sense. And as of right now, the general consensus is that the GLP-1 hormone itself doesn't cause hair loss. So is there maybe something else that's going on? Now, before you panic, I promise not to leave you high and dry with no answers at all. We're going to kind of go over some of the plausible other ideas that are being speculated. And again, one of my own ideas that I think might be going on. Number one, diabetes-related hair loss. So many people that are taking the GLP-1 receptor agonists are using them for diabetes management. And what we know is that hair loss has definitely been linked to type 1 and type 2 diabetes. Again, we're not entirely sure how diabetes might ultimately lead to hair loss, but there is speculation that maybe it's something to do with high levels of sugar, blood flow not getting into the hair follicles. We know that high blood sugars can cause other issues, such as in your eyes and your kidneys, which have areas of small, tiny vessels. Same thing with our scalp and with our hair follicles. So maybe there's something going on there that ultimately the diabetes then leads to hair loss. So maybe it's just a correlation aspect that these individuals have high blood sugars and they happen to be taking these drugs at the same time. And it just so happens they coincide that they started the medication and then suddenly their diabetes got worse enough that their hair started to fall out. But of course, on the interwebs and such, some people that are taking these medications don't have any diabetes. So what else could be going on? Number two thing that we're looking at here is maybe they're taking other medications. Again, in particular, when it comes to diabetes, some people are taking multiple medications in order to manage other conditions and comorbidities that might be coming along with the diabetes, such as high blood pressure, kidney disease, and that sort of thing. And so maybe it's those other medications which have potentially been linked to hair loss that's actually causing the hair loss and not the GLP-1 receptor agonists themselves. So drugs, again, that are managing your blood pressure, such as ACE inhibitors, this would be things like ramipril, perindopril, or high cholesterol medications, the statin type medications, in rare circumstances have been linked to hair loss. And as a quick disclaimer, if either of the above apply to you in that situation and you have diabetes and other medications and you're losing your hair, please don't stop those medications. Please, please, please follow up with your care provider before you stop any medications or make any changes to your regimen, making sure that you're both in agreement and have done a proper assessment before stopping or changing anything. Now, again, what about the people that don't have diabetes? They're not taking any medications. The only medication they are taking is this GLP-1 receptor agonist for, say, obesity and weight management, and they're still losing their hair. So what gives? What the hell is potentially going on here? So in this situation, I have a personal hypothesis, and I don't have any literature to back this up. It's purely theoretical. As I said, I also haven't worked with anybody or had any client or patient that has been experiencing hair loss because of a GLP-1 receptor agonist, at least that they haven't reported to me. So this is all very hypothetical, theoretical, just based on how I know the body works and some of my other clinical experience that I have seen in individuals that are not only trying to manage their weight, but are also working with the GLP-1 receptor agonists. And my hypothesis is that the individuals that are potentially experiencing this hair loss due to the GLP-1 receptor agonist, it might be a case of malnutrition, in particular, not consuming enough calories and not consuming enough protein. And in these situations, this can lead to a condition called telogen effluvium. Hopefully I said that right. Maybe some dermatologists can come on here and correct me, but that is the potential condition that might be occurring with regards to malnutrition and hair loss. Basically, what this condition is that your body is experiencing some sort of stressor that ultimately shifts your hair follicles into more of a resting phase. So it goes from the growing phase into a resting phase. And when your hair follicles are in a resting phase, they're basically just chilling and hanging out and kind of twiddling their thumbs like this, not really doing anything, and they're not growing because your body's undergoing some kind of stressor. So it's going to be letting your hair go and not growing new hair, ultimately leading to hair thinning. And it usually involves the entire scalp. So it's not kind of more in my male pattern baldness. It's over your entire scalp that this hair thinning will occur. And potential triggers could be things like malnutrition, so not eating enough. It could be due to medication, surgery, illness, weight loss. All of these things can be potential triggers that cause this stressor and cause your hair follicles to shift into this resting phase. Now, generally, this is a self-limiting condition. And what I mean by that is that once the stressor is corrected or the potential trigger is taken away, your hair will then shift back into a growing phase and the hair thinning should resolve within a 3 to 6 month period. So, how did I come to this conclusion? Well, in my experience, I've worked with a large number of people that have been referred to me that have been put on a GLP-1 receptor agonist, and we take a look at their dietary patterns and lifestyle and stuff. And they're consuming way less than 1,200 calories a day just because the medication allows them to do that. And on a good day, they're maybe consuming about 50 grams of protein. And this has, again, if you haven't been watching me for a while, been an ongoing concern of mine when it comes to these medications, is that these medications do reduce your appetite and food-seeking behaviors. But in some situations, it can lead to it being so low that you are just not consuming enough calories in order to survive. And a lot of people might think that 1,200 calories per day is enough. For a majority of people, it isn't. Even for like a 10-year-old toddler, they need at least 1,400 calories a day just to maintain normal and optimal functioning. So you as an adult, which is considerably bigger than an 11-year-old toddler, need considerably more calories. And if your body detects that it's not getting the necessary nutrients it needs, it's going to shut down non-essential functions. And I hate to say it, as important as your hair is to you, it ultimately is not important to your body's survival. Now, another thing that I want to point out here is that when I've worked with these individuals and they've been eating this 1,200 calorie a day diet, and I believe they're not getting enough nutrients, we've still done blood work and their blood work has still come back within the normal limits. And that's because, well, your body is very resilient. It's very good at prioritizing what it needs and making sure that the markers of malnutrition, such as your albumin levels and that sort of thing, are still at an adequate level. So it's still going to make sure that those aspects for necessary function are still at a high enough level. It wouldn't be until you go a significantly longer period of time being malnourished that would lead to issues and problems in terms of showing up on your blood work. So your blood work can look normal, absolutely, but that still doesn't mean that you're not consuming enough calories. The other thing I want to point out here is that there's a big difference between surviving and thriving. When someone works with me, I never have them consuming less than 1,500 calories a day. And even then, it's only a very rare circumstance that we will go that low. Even then, it's usually a lot more than that, upwards of 1,800 calories and up, in order to properly nourish your body. And hey, guess what? Weight loss and weight management can still occur at those higher calorie amounts. And in fact, if you feel like you need to eat less than that in order to lose weight or to feel healthy and such like that, you definitely need to book a consult with my team and I so that we can better support you in getting that calorie amount up and helping your body not to just survive, but to thrive. And just to give you a bit of perspective, the absolute minimum amount of protein that someone should be consuming on a day-to-day basis in order to survive is about 0.8 grams per kilo or about 0.4 grams per pound. That's like the minimum. That's the minimum amount in order to prevent malnutrition. So if you are not eating 0.4 grams per pound of body weight or 0.8 grams per kilo of body weight, then you are not getting enough protein on a day-to-day basis and could be malnourished. Now, if you're wanting to lose weight or, well, do anything that is of activity or just, living a more healthier lifestyle and feeling better, you need to be consuming considerably more protein, upwards of 1.2 grams per kilo of body weight, or I like to keep it nice and simple as 1 gram per pound of body weight. Now, that works for a majority of people, not everybody, obviously, but that gives you kind of a good area to start with and to aim for. So if my hypothesis is correct, then when an individual starts to consume and eat more calories when they're taking these medications, we should start to see the hair thinning and the hair loss not only slow down and subside, but should start reverting back to normal within 3 to 6 months if they consistently consume enough calories and enough protein. A lot of people will say, well, I did it for a week and my hair growth didn't come back. Your hair growth and such like that is a very long-term and slow process. Think about just how slowly your hair grows. It takes time for these processes to reverse, to shift out of these stressors and that sort of thing. And it's going to take a hell of a lot longer than just a week to correct it. You need to do it consistently in order to keep your body out of that stress type response and shift it into the growing phase. And not only that, when you start consuming and eating more calories, not only is it likely that your hair growth is going to come back, but you're probably going to feel a whole hell of a lot better in all areas and aspects of your life and going to be probably having better workouts, maybe even building more muscle, getting more toning going on. All of these wonderful and amazing things are likely going to happen because you're actually feeding and providing your body the nutrients it actually needs. And the beautiful cherry on top of this is that, many of my clients and patients that we've increased their calorie intake up on them, they've still been able to lose weight. And hey, they've actually been able to keep the weight off in a lot more of a sustainable fashion. Now, again, I don't have any experimental evidence or case reports to say that this is the case. I am waiting and hearing. If you have the experience of you were experiencing hair loss with one of these medications or what have you, and you started eating more and suddenly your hair growth came back, drop it in the comments below. Let us know what's going on. Of course, hair loss can happen for other potential reasons, and regardless of what is occurring and going on, you should still follow up with your doctor to make sure that everything is all hunky-dory and good to go. So there you have it, you beautiful people. The GLP-1 receptor agonist might indirectly lead to hair loss. Again, we don't have any good literature to back this up or to say yay or nay, We have a couple of ideas, and until we get some more case reports and ideas as to what is going on, this might be the current situation as to what is occurring. And in some cases, you might just be an unfortunate soul like myself who got some great genetics from your parents. And unfortunately, you are just going to lose hair because that is just the course that life has in store for you. So, hopefully, that's provided you some perspective, some ideas. Again, check with your healthcare provider if you are experiencing this side effect or really any other side effect to make sure that things are all good and hunky dory, if you will. And of course, everybody, as always, don't forget to hit the subscribe button down below so that you don't miss another episode. Check me out on my other channels at the official Dr. Dan. I'm on the gram, the book, the tick, the talk, you name it. We are out there. And of course, if you need some more additional support in your weight management journey, check out my website, healthcareevolve.ca, where you can book a free consult with myself and we can see if you're a good fit for my team and I. And of course, until next time, you beautiful people, always remember that small tweaks lead to massive